Why is the current medical system failing to treat chronic disease? Today, many of us are suffering from one or more chronic diseases. It's even affecting our children. Chronic conditions including cardiovascular disease, cancer, chronic respiratory conditions, chronic musculoskeletal conditions, diabetes, and mental health conditions are killing us at an alarming rate. The scary thing about this, 85% of chronic diseases are caused by lifestyle and environmental factors, and they are not genetic. We have more control over our health than we like to think. Australians are living longer than ever before, but half of us are suffering with at least one chronic condition, which can affect the quality of our lives as well as those of our family and friends. Chronic conditions are Australia's leading cause of ill health and have serious implications on our health system. 2018 statistics from the Australian Institute of Health and Welfare state 63% of Australians aged 18 and over are overweight or obese. 28% of children between the ages of 5 and 17 are overweight or obese. The lead causes of death between the ages of 45 and 74 are coronary heart disease and lung cancer. The lead causes of death between the ages of 75 and above are coronary heart disease, dementia, and Alzheimer's disease. The top 5 leading causes of death in 2016 were coronary heart disease, dementia and Alzheimer's disease, cerebrovascular disease, lung cancer, and chronic obstructive pulmonary disease. Around 45% of Australians aged 16 to 85 will experience a mental illness in their life. 1 in 2 Australians have chronic disease. 1 in 3 adults and children have chronic respiratory conditions. 1 in 3 people have arthritis and other musculoskeletal conditions. 1 in 10 adults show biomedical signs of chronic kidney disease. 1 in 20 adults self-report having diabetes. 1 in 11 people aged 65 and over have dementia. 1 in 3 Australian adults have high blood pressure. 1 in 4 Australians have 2 or more chronic conditions in 2015. 87% of deaths in 2015 were associated with chronic disease. Chronic disease accounts for 61% of total disease burden, and 37% of hospitalisations are due to chronic disease. What are we doing to combat chronic illness? These numbers are typical of westernised countries like Australia, America, and the United Kingdom. In 2017, chronic disease was responsible for 70% of deaths globally, and these numbers have been increasing. It doesn't make sense. Why do we accept chronic disease as normal? When will we start to value our health? What does health mean to you? 90% of chronic disease is caused by environmental factors, and this means that we must be focusing on diet, sleep, physical activity, stress management, and minimising toxin exposure if we are to prevent and reverse chronic disease. There are 3 main reasons why the current medical system is failing with chronic disease. Number 1, our modern diet and lifestyle are out of alignment with our genes and biology. We are not paying enough attention to our health, and we are focused on treating symptoms and not the cause of our health issues. Number 2, the biggest challenge we are facing today is not acute disease, but chronic disease, and our medical system is not set up to tackle chronic disease. If you have an accident or an injury, the hospital is the first place you should go. If you have a chronic illness, you need to take a good hard look at your lifestyle and your environment. Number 3, our model for delivering healthcare does not support the top 5 interventions that would have the biggest impact on preventing and reversing chronic disease. These are diet, sleep, stress management, physical activity, and social connection. When was the last time your doctor asked you about your lifestyle? On average, 406,000 visits are made to a GP in Australia each day. The average appointment time with the doctor is 10 to 12 minutes. This is not enough time to investigate a patient's lifestyle and behavioural issues that are causing their symptoms. This is not the fault of our doctors. We simply don't have enough doctors to take care of the rising health issues, and doctors have very limited time to spend with their growing patient lists. Spending on healthcare in Australia has grown by about 50% over the past 10 years, from $113 billion in 2007 to 180 billion in 2017. That's more than 7,400 per person. 39% is being spent on hospitals and 35% on primary health care. And yet we spend less than 5% on public health measures that would educate people on healthy behaviour changes that could actually lower chronic disease and prevent illness in the first place. Recent studies have found that 84% of the risks of chronic disease are not genetic, but environmental and behavioural. Our genes do play a role in determining which diseases we are predisposed to, but the lifestyle choices we make and our environment turn out to be a far more important determinant of our health and well-being. Many chronic conditions share common risk factors, such as excess body weight, tobacco smoking, excessive alcohol consumption, poor diet, and insufficient physical activity, all of which can be modified through lifestyle changes. The interventions that we desperately need to address the chronic disease epidemic require us to invest far more resources into promoting health, which is just the opposite of what we are doing today. We are promoting the magic pill over healthy behaviour changes. By reducing our exposure to lifestyle risk factors and focusing on healthy behaviour changes, Australia could cut its total disease burden by 1/3. And this is where many people believe health coaching can be the future of healthcare.